Hi, and welcome to the weekly. This is your source every Thursday for the latest trends and innovations we're seeing in the marketplace. So, this is Valentine's Day. And in a year where we spent so much time together with our loved ones, it was probably a good time to check in and make sure everything's okay. All right, it's okay here. So, not sure if you asked, but I'm good. And also, our days are getting longer. In 30 days, we're going to move the clock forward. More people are going to be vaccinated. We're just going to be in a better spot. So I'm going all optimistic this week. Our sponsor for today's show is Unilock Pavers. And their motto is designed to connect for both walls and for paving. And they bring a very customized approach to their business around sizes and edges and finishes and colors. And with all that customization, it basically allows you to execute your design vision. It's a great process. Check them out. So we've been hearing so much about the changes in our marketplace. And one of them is healthcare. It's changing like crazy. And this is what people are saying. They want it to be local. They want it to be accessible. They want it to be convenient. And they want it to be decentralized. It almost sounds like an Amazon experience. But you want to know something? That's where we're heading. It's kind of the retailing of healthcare.
For several years now, we've been monitoring the different generations, and we know, just-in-time delivery of care or retail services drive was starting to drive a lot of the retail health decisions and how we deliver care in all healthcare facilities, whether it's in or outpatients. But the trend wasn't as high. I think a few years ago it was probably sitting at 63%, and now it's 83. We found that it's 83% of the patients prefer a healthcare facility nearby versus a new or renovated facility. So it's still real, prevalent. Folks do not want to drive very far for care. And as the millennials grow, it's going to get worse and worse. But even the 65-year-olds, we found that they're just as demanding. They want just-in-time delivery, just like they want their food. So they want health care, easily accessible. They don't like drive times. I thought that was a big jump in that statistic. Also, the average commute, it has shrunk. It used to be they would tolerate a drive time of 30 minutes to get to care. Now it's shrunk to 20 minutes, which is really shocking. So when we decide as healthcare providers or developers where buildings need to go, we need to keep that in mind. That is a driver when you look at site selections. And our analytic department, we put that in our evaluation tools and help clients find the right spaces that fit that type of statistic.
It's going to change. This healthcare experience is going to change. And it's funny that we bring up the word retail because our next segment talks about retail. Because what if we heard? We heard that retail is dying and online sales, that's the way it's going. But is it? And what is that experience going to be like? And will people end up going back? Is that something we crave to touch and not buy things online? So we go to the other end of the world. We go to Australia. I'm pretty sure this is our furthest guest so far. And they give us insights about what that experience is going to be like for retail going forward.
Well, I don't think it's as serious as people make out. I think people always like to look for headlines. And as a journalist, I'm sure you're in search of those.
Sure.
Guilty as charged.
There are retailers, largely retailers with big spaces, as I mentioned previously, that will have to radically reinvent what they offer and how they offer it. There's no doubt about that. There was a move pre-pandemic for some large retailers to become more localized, simply because space is getting expensive or they're running out of it, or people's shopping patterns were changing, particularly in food. People were shopping, every day as opposed to once a week. That's changed slightly since the pandemic's been around, but there was a move to localize stores to make them smaller, particularly in food, and to make them closer to the customer. So that's going to continue. And I think this whole notion of local will be explored more vigorously by retailers over the next year or two. Because I think local is about knowing the name of the butcher who's been serving you for 20 years. I think it's about being recognized and rewarded just by your physical presence. And I think people are scared of traveling distances and like things that are familiar. So I think the familiar, which you find when you're shopping near to where you live, will become very important. And I think actually how large retailers explore that notion will become very interesting. And I don't think it's about putting the name of your location on the shop front or taking a photograph of the nearby beach or whatever, because that's a little bit facetious. I think it's going to be broader and more real than that. And actually, I think it's really about understanding how to engage with the community that surrounds you.
I find that fascinating. I think something big is going to change in retail. And what that experience is going to be for the consumer, I think we're going to see innovation in that marketplace like we're not going to see anywhere else. And I'm looking forward to it. I think it's going to be really cool to see what comes out. So that ends our show for today. Thank you very much for joining us. Big shout out to our sponsor, Unilock, who has pavers and wall systems, and they go across multiple markets. They have education, they have healthcare, they have retail, they have office, and they have multifamily. So that customized experience they bring hits all the different segments that are important to you. We'll be back next week. If you missed any of our shows, they're available on YouTube TV and on Horizon TV. If you'd like to see anything or want to just drop me a line, here's my email address. Please be safe this week. Let's stay the course. Things are getting better. Yay. And very much look forward to seeing you next Thursday. Thanks for joining us.